I'm Mike, and today I'm not going to be talking about a political solution to our healthcare problems here in the US. I am going to be talking about a single lifestyle change that can lower our sickness levels and medical needs by so much that it could free up hundreds of billions of dollars in healthcare costs and also prevent, say, $500 billion in lost income. On a personal level, that could mean recovering up to 1/5 of your income and achieving a better quality of life. The net result is unburdening our healthcare system to the point that it is no longer disastrous. Before we look at that single lifestyle change, let's get to know the problem. Let's take a look at the numbers. As usual, all the sources will be linked below. Our healthcare debacle is very complicated, but simply put, it is twofold. The first of which is diseases and their human toll. Heart disease, our number one killer, kills over 600,000 people a year. Nearly 10% of the population has diabetes. About 1/5 of the population is disabled. You already know that 68% of our population is overweight or obese, and our number of yearly ER visits is nearly half that of our population. And just going to the hospital at all can be dangerous. Between the 100,000 people that die every year from adverse effects of prescription drugs, the unnecessary surgery, the hospital-borne infections, and the doctor's errors, we have a total of about 225,000 to 284,000 deaths by medical care every year, making it our third leading cause of death. I could go on, but you get it. The other half of the problem is financial. If you are sick in the US, you're screwed, whether you have insurance or not. Maybe a doctor needs to clear some fat out of your arteries, aka give you an angioplasty. That's $27,000, and in terms of out-of-pocket expenses, it's hundreds of dollars, or maybe even thousands of dollars in co-pays and deductibles. And maybe you need a bypass around your clogged arteries. That's gonna be $75,000, which is even more in out-of-pocket expenses. For most, any ailment could mean going into medical debt. As we know from that very recent Bankrate survey, about 63% of Americans cannot cover a $500 expense. So it makes sense why this 2009 study found that 62% of bankruptcies are medical in origin. Now, this does have its critics, but there's no denying that about 57% of all the bankruptcies in that study were people who had $5,000 or more in medical debt. And finally, that the single leading cause of bankruptcy is medical debt. But not everybody's going bankrupt. However, everybody does hate paying taxes, so to put it into perspective, the average amount of federal taxes paid in the US is 20% of income. That goes to cover everything in the federal government. But health insurance alone averages 10% of total income, and some people are paying up to 25% of their total income on health insurance. Emergency room visits are costly, but it's the chronic diseases that actually break the bank, with 86 cents out of every dollar going to treat people with chronic diseases, and over half of the US population has at least one chronic disease. And how might that affect your earnings, your income? Well, from this paper, in the long term, having a chronic disease eats away 18% of your total income. So to summarize the personal financial effect, health insurance costs 10% of your income. Having a chronic disease prevents you from earning 18% of your income. And if you're going bankrupt, it's probably because you went to the doctor. And now to a larger economic scale, it is clear that we are spending way more money on healthcare than comparable countries. And to quantify that, back to chronic diseases again, according to the Milken Institute, lost productivity from our most common chronic diseases cost us $1.1 trillion a year, which is 4 times the total treatment cost for those same chronic diseases, coming in at around $277 billion. That is where the real money is going. Okay, we get it. Between the human and financial toll, it's really bad. You now know the scope of the problem. And everybody has a different opinion on how to solve it in the political arena. However, we can all agree that by having less sickness, particularly less of those chronic diseases that do so much damage, we're gonna be a lot better off. Okay, now to that solution I spoke of in the beginning, and that is a vegan diet. Please bear with me. I know this is a trigger word for people. Please put your misconceptions aside about what you think about vegans and certain vegans you know, etc. But the reduction in those chronic diseases that are so expensive has been measured to go down to a level that would make our healthcare crisis manageable again. All right, now let's look and see how a vegan diet stacks up against various diseases and major risk factors for disease. Okay, let's start with hypertension or chronic high blood pressure. It is the #1 risk of death in the world. According to the CDC, 1/3 of the people in the US have it. It costs us $46 billion a year, and it contributes to the death of 1,000 people per day. Depending on which large-scale study involving vegans you look at, vegans have a 60 to 75% less incidence of high blood pressure than their surrounding population. I know, it's hard to accept that those smug vegans could be onto something, but the nationwide adoption of a vegan diet could save us $28 to $35 billion a year, and also remove the leading risk factor for death and disability by, 60 to 75%. And that's just a sort of standard American vegan diet, which still boasts about a 10% reduction in heart disease. But a whole food vegan diet, that's another situation, and in terms of cardiovascular diseases in general, has been shown to reverse it, being far more effective than any operation or medication could ever dream of being. This study took 198 people with advanced cardiovascular disease and started them on a vegan diet. 21 people dropped out, and over the next 12 years, 62% of them had adverse effects like heart disease or stroke. Of the 177 that stuck with it, their arteries cleared up, and only 0.6% had adverse events. That is 100 times less heart disease and stroke. Can you imagine if instead of 600,000 people dying every year of heart disease, we only had 6,000? Imagine if we could bring those 800,000 deadly and disabling strokes that we have each year down to just 8,000. It doesn't stop there. Quickly, diabetes. Between type 1 and type 2, that's 10% of the population that have it, and it costs us $245 billion a year. But vegan populations have been shown to have 47 to 78% less diabetes than their neighbors. Let's keep it going. Obesity is a risk factor for a set of diseases that adds up to $1.5 trillion a year, and it also contributes to 300,000 deaths. Well, large population studies show that vegans, not vegetarians, are the only group that averages in the normal BMI. Everybody else, overweight. When the insurance company Geico put their workers on a whole food plant-based diet, they lost about 6 pounds over a few months, eating as much calories as they wanted. And in this study on prostate cancer, they inadvertently found out that a vegan diet with light walking beats out an omnivorous diet with strenuous exercise for 45 minutes, 5 days a week for 14 years straight. The vegans were in the normal BMI range, and the strenuously exercising omnivores still overweight. And did I mention that the vegan blood killed twice as many cancer cells in a petri dish? Worth noting. There are so many other diseases and amazing studies that I could talk about, but let's cover how being sick affects your work. Remember the Milken Institute, where lost productivity from our most common chronic diseases caused $1.1 trillion per year? Keep that in mind. From this 22-week whole food vegan workplace intervention, the vegan group reported a 40 to 46% decrease in health-related productivity impairments at work, which is a very statistically significant finding. Though this isn't a perfect comparison, if we take that figure and we combine it with the Milken Institute data, then we can save $500 billion in lost productivity due to health impairments from chronic diseases alone. It is worth noting that the people in the workplace intervention missed less daily activities like family events, and the vegans were actually more satisfied with their food. Be aware, this isn't just some fringe idea that I'm suggesting because I'm vegan. If there's anybody that knows how to reduce disease rates, it's Kaiser Permanente, our nation's largest HMO or health maintenance organization, which is essentially a health insurance provider service. From 2013, quote, physicians should consider recommending a plant-based diet to all their patients, encouraging whole plant-based foods and discouraging meats, dairy products, and eggs, as well as all refined and processed foods. They simply did the math. This all begs the question, how do you actually get people to adopt a vegan diet large scale? It's a bit like saying, hey, if everybody got a PhD, then we'd be the most educated country. Duh. Well, as you may know from the movie Plant Pure Nation, government is not even close to saying that plant-based diets are healthy at all, so it looks like we need to take other routes. One would be talk to your insurance company about offering incentives to adopt a vegan diet and meeting certain health markers, or you can also talk to doctors that value health over pharmaceuticals and tell them what Kaiser Permanente says. We can also start vegan diet programs like Kickstart Your Health Rochester and other ones that have been done in the past that have had amazing results with biomarkers and things like that. But most importantly for you, solve your own personal healthcare crisis if you have one by adopting a whole food vegan diet. Did I mention it saves animals' lives? In the end, nationwide adoption of a vegan diet could likely save $1 trillion in medical expenses and lost productivity. A whole food vegan diet especially can prevent hundreds of thousands of heart attacks, strokes, new disability cases, high blood pressure, and other chronic diseases. The net effect could be a country with healthcare instead of a healthcare crisis. And on a personal level, if you are able to prevent a disease that might jack up your health insurance to 25% of your total income and add that on top of the 18% of income lost from a chronic disease, it can be a very good option. Finally, people believe they have a problem with vegans, but their real problem is healthcare, and it can be solved through a vegan diet. And this is largely an educational issue, so if you want to, feel free to share this video and help people out, and hopefully we can just put our differences and preconceived notions aside and get some people healthy. I'm not saying we're gonna prevent every disease, but that's a healthcare crisis solved. Alright, that's it for today. Links are in the description below. Subscribe and like if you haven't already, and thanks for watching.